Thank you, moderator. Good afternoon, moderator. Good afternoon, participants. I am Suleiman Lakoh, MPH student of Sierra Leone University. I did a study as part of my thesis on ownership and use of insecticide-treated nets at a community in Freetown that is called Dworzark Community. This is the outline of the presentation as suggested by the e-conference team of Sierra Leone University. We are going to look at introduction, statement of the problem, methodology, we look at results, discussions, and references. As a way of introduction, we assessed the ownership and use of insecticide-treated nets by pregnant women at a community in Freetown called Dworzark Community. We all know that insecticide-treated nets are the cornerstone of malaria prevention efforts in Africa. So if we want to prevent malaria in sub-Saharan Africa specifically, we have to depend on the use of insecticide-treated nets. Now, even with this very important aspect of malaria prevention, only 53% of the population that is at risk, pregnant women, are inclusive in this one. Only 53% of this population that are actually using insecticide-treated nets in sub-Saharan Africa. And these are according to the WHO reports in 2015. So what we did, a cross-sectional study that assessed ownership and use of ITN by pregnant women. And with this, we only found out that 30.3% of pregnant women in this community actually own ITN. But there is a good news that says 97.2% slept under bed nets the night before the survey. And a greater number of these women actually have been sleeping under bed nets regularly in the past 3 months. That's about 79.2% in the last 3 months before the survey. ITN ownership by household is not significantly different from ITN ownership by pregnant women. It's about 35.4%. Now, malaria remains a major public health problem in Sierra Leone. It is the most common cause of illness and death in this country. It accounts for about 50% of all admissions in primary healthcare facilities. It also accounts for about 30% of all mortality in Sierra Leone. It's a contributing factor to the high malaria burden is the unavailability of ITN. Pregnant women and children under 5 are the most vulnerable group. So this is what informed our decision to actually assess pregnant women that are in the particular community that we studied. Now, the study surveyed a total of 333 pregnant women between the month of February and March 2017 and employed a cross-sectional study design, as I mentioned earlier on. It was carried out in Freetown, a community called Dworzark Community, which is Sierra Leone's capital, which has a population of 1.4 million. That's the whole Freetown has a population of 1.4 million. The respondents were selected by a multi-stage sampling technique. So initially, we selected various zones within Dworzark Community. Out of the 20 zones, we selected 10. Then out of those ones, we selected, out of the 25 streets, on most of the zones, we selected 5. And then we did a random sampling. We start with one house and then progress like that until we are able to get our sample size. We calculated the sample size using Leslie Kish sample size calculation formula for estimating single proportion studies, which say sample size, which can be denoted as n, equals to z square pq over d square, which talks about the precision. So we calculated the sample size and we are able to get 333. So we assessed those ones by visiting over 400 households. So we did a quantitative data collection from the respondents using an interview-administered semi-structured questionnaire, actually formulated based on previous stories that have been carried out on ITN use. We employed the services of 3 young doctors in the study area that assisted in data collection after a thorough practical training by myself as the principal investigator. Now we realized that the mean age of the surveyed pregnant women was 28.49 years. That's the mean age, even though the range is between 15 to 48 years. Now, while only 30.3% of pregnant women own ITN, as I mentioned earlier, all those that own ITN, almost all, that's 97.2%, slept under a bed net the night before the survey, and over a 3/4 of them have been sleeping under bed net regularly in the last 3 months that precede the survey. Now, when one look at this, if you look at other studies that have been carried out, one of it by Ugu et al. In Nigeria, it's not very much different in terms of ownership, but it's below the threshold that actually the prevalence that they got, the proportion they got is for 3.1%. We got a proportion of 30.3%. So it's still below, even though both of them showed in Africa, or in most parts of Africa, or some parts of Africa, there is low use of ITN. Now, the sources of ITN use for pregnant women include street traders. About 38% of street trader ITN are obtained from street trading. Then mass campaign distribution, which actually is being carried out by government, is carried out by its government and its partners, account for 25%. Then 18% of the pregnant women that own ITN said they obtain ITN from health facilities, and 15% said they obtain them from shops. The reason given by pregnant women for not sleeping under ITN is majorly unavailability. So 79.7% of pregnant women said because ITN are not available, that's why they are not using this ITN. And this is followed by heat, which accounts for about 25.8%. So they have some form of discomfort when they use ITN because of heat. Some said there is some form of discomfort because they dislike the odor of the ITN. That is what is used to impregnate ITN. Then some people said, okay, we are using some other forms of malaria prevention, for example, environmental cleaning. So as a result of that, we are not using ITN. About 13.8% actually cited different causes, for example, like cost, some say inconveniences, and some say there is some form of allergy to ITN use. That's like itching. So as a result of that, they are not using ITN, but they account for minority. Now, if one look at this one, use of ITN by pregnant women is shown to be statistically associated with their educational status, the age, and the presence of a child below 5 years in a household, and ownership of at least one ITN. Now, if the more educated the woman, the more likely the woman to actually own and use ITN. The more the age of the woman, the more likely that woman is likely to use ITN. And having also a child below 5 years, as well as the ownership of ITN, also influences use of ITN. This is in agreement with a study that is carried out by Honorido from Nigeria also, that says educational status has a significant association with use of ITN. For them, age was not a significant association, and even ITN ownership was not a significant association, but we have some aspect of intersection, which is educational status. But age, on the other hand, does not influence ITN ownership and use by their own study. Now, before I finally conclude to tell you the references, I had some limitations which I did not include in this because of the number of slides. Limitations I had: one, the area that I carried out the study is a hard to reach area. So it's very difficult for us to access the places. Then another thing also that we have a difficulty on, some of these pregnant women thought we are coming to provide supplies. So some women want to actually join, even though they are not pregnant. They want to falsify as if they are pregnant. But the way we actually circumvent that, we employ the activity of local authorities like the chiefs, the other people that are in the area. So they assisted us by identifying women that are actually pregnant. Apart from the fact that we also utilize ANC services, for example, the cards that are given them at the ANC facility. In conclusion, we realize that ownership of ITN is low. Even when ownership of ITN is low, we happen to get a significant number of women that own ITN and use ITN. So I encourage the government to actually put effort in providing this particular commodity, which is essential in malaria prevention. But we also think awareness raising is also very, very important. So we encourage the government to use the media, the authority, community people, and even women that own and use ITN as a way of increasing the ownership as well as use of ITN. There are other things also we think on a wider perspective one need to encourage, which is educational status.
Yeah.